You know, we're still very much in the middle of it with rising hospitalizations and, you know, rising positive cases, and still don't have all of the equipment we need. We're still working to get the test kits we need and the contact tracers that we need. And so we are still very much in the thick of this. It is far from over. And our hospitals are running probably at least 70% capacity right now. So this is a real concern for us. You know, you're hearing all around the country, people are anxious to open up. The question is, if we're operating at 70% capacity right now in our hospitals, if we open up prematurely, we don't know what situation we may be in, because we expect that the cases will rise. So we have to be very careful. I've understood from hearing from them that we think this is going to cause some residual devastation for our first line responders who are right now in crisis mode. So they're responding and they're doing an exceptional job. But I think we expect that there will be some mental health toll that happens for those who've had to see so much illness and death. So we're going to have to keep an eye on all of our first responders, because this has been a circumstance that, no matter how experienced, no one has ever seen before. So I'm hearing from them that it's tough. It is really tough, but they have done an amazing job. People do want to work. They want to open up their businesses again. You know, I can understand that people are feeling anxious to get outside, but the messaging that I'm getting is people have been super responsible about this. I got a number of messages over the weekend after hearing that I am not anxious to move us too quickly. They said, you know what, we're with you on that. That people don't want to be sent out there to get sick and to die. And again, the people we're talking about who are getting sick and dying are people we love. So I appreciate that people have been patient. But you know, the other key to it is this: as long as you provide for the needs as best you can, I think that people will remain patient. So we had already, before COVID, developed the kind of relationships through COG where we were seeing ourselves not just as individual jurisdictions, but as a strong region. And that we, you know, basically all boats rise at the same time. We realize that our destinies are tied to each other in really amazing ways. And so we had that recognition and had the relationship prior to COVID, and it's continued. And now that we're going to recover together as well. The organization that has played such a vital role in the region and helping leaders like me to be successful in these spaces where we, you know, we try our level best, but you know what, we rely on each other. So the expertise, the support has been, you know, critical, because we all have, at the end of the day, the same objective. We care about people.